There is a little-known truth that is crucial as we reach our 60s. You don't lose strength because you age, you lose strength because your legs weaken. Surprisingly, according to many leading gerontological studies, lower limb strength, particularly in the thighs, buttocks, and calves, is the most accurate predictor of independence, vitality, mobility, and even longevity, rather than cholesterol, weight, or blood pressure as many people believe. When your legs weaken, you not only lose the ability to move, you face the risk of imbalance, falling, and gradually losing independence in daily activities. The problem is, this muscle loss doesn't happen suddenly but quietly day by day, until you realize you get up more slowly, find it harder to walk upstairs, and experience joint pain or cramps more frequently. Unfortunately, most people misunderstand. They think it's due to insufficient exercise. But in reality, behind this weakening are complex physiological changes. From nutrient absorption disorders, hormonal changes, to mitochondrial dysfunction and motor neuron signaling. The good news is that science today has confirmed the existence of 3 essential vitamins that can strongly support muscle recovery, improve balance, stabilize joints, and protect the nervous system, if used correctly. The problem is, many seniors still only focus on protein and exercise, which are important, but overlook the crucial role of vitamins. Meanwhile, these vitamins act like switches to activate the entire musculoskeletal neurological system. In this video, based on the insights of Dr. Mark Hyman, I will guide you step by step to understand and apply those 3 important vitamins. One type helps increase mitochondrial energy and maintain muscle fiber strength. One type regulates neuromuscular function, helping you become more stable and avoid falls. And one type helps reduce inflammation, maintain joint flexibility, and alleviate pain and stiffness. You don't need to completely change your life. Just adjust a few small choices each day, and your body will respond with greater strength, independence, and flexibility after 60. You will also learn exactly why these nutrients work, what is happening inside your body when you take them, and how to apply this knowledge immediately in a simple way. This is a scientifically proven protocol, because ultimately, stronger legs are not just about looking good or moving more easily, but also symbolize independence, the ability to live fully, travel, play with grandchildren, and maintain cognitive sharpness. But before we begin, don't forget to like and subscribe to our channel. If you're over 60, you've likely heard that vitamin D is essential for your bones. And that's true. But what most people don't realize is that vitamin D3 is equally, if not more, critical for your muscles and nervous system, especially when it comes to maintaining strong, stable legs. Let's break this down scientifically. Muscle movement isn't just about contraction. It's a finely tuned interaction between your nervous system and your muscle cells. This process, called neuromuscular signaling, is like a symphony. Your nerves send electrical signals, your muscles respond by contracting, and your brain coordinates these signals to keep you upright and moving smoothly. And this is where vitamin D3 plays a hidden but essential role. Research published in the Journal of Clinical Endocrinology and Metabolism by Bischoff-Ferrari et al. In 2004 discovered that vitamin D receptors are located directly inside muscle tissue, especially in the type 2 muscle fibers. These fast-twitch fibers are responsible for explosive strength, balance, and quick reactions, the exact qualities that deteriorate with age and increase the risk of falls. When vitamin D3 binds to these receptors, it stimulates protein synthesis and muscle fiber maintenance. But if your D3 levels are low, those receptors underperform. Your fast-twitch fibers weaken, reflexes slow, and your risk of falling increases, often silently. This is a leading cause of hospitalization and loss of independence in older adults. Have you noticed feeling a bit unsteady when rising from a chair? Or less confident walking on uneven ground? That may not just be aging, it may be a silent decline in your vitamin D3 levels. A meta-analysis published in BMJ in 2010 looked at data from over 30,000 participants and concluded that supplementing with vitamin D significantly reduced fall risk in older adults by improving both muscular strength and neuromuscular control. But the benefits of D3 go even deeper. Vitamin D3 also helps regulate intracellular calcium, which is essential for muscle contractions. Without D3, your body struggles to move calcium efficiently into and out of cells, disrupting the contraction-relaxation cycle of your muscles. This not only weakens your legs but makes them less responsive. And the neurological benefits? D3 plays a key role in producing neurotransmitters like dopamine and serotonin, vital for motor coordination and mood stability. Low levels of D3 have been linked not just to muscular weakness, but also to depression and cognitive decline. In older adults, these can combine into a vicious cycle. Feeling weaker leads to less movement, less sunlight, more vitamin D deficiency, and further decline. Dr. Mark Hyman, a pioneer in functional medicine, explains it clearly. Vitamin D isn't just a bone protector, it's a molecular activator. It switches on the systems that keep us moving, balanced, and mentally sharp as we age. Especially after 60, this vitamin is a non-negotiable foundation for healthy longevity. So how much D3 should you take? For most seniors, a daily intake of 2,000 to 4,000 IU is optimal, depending on your current blood levels. Always check your 25-OH-D level via a simple blood test. The optimal serum range is typically 40 to 60 nanograms per milliliter. Because D3 is fat-soluble, take it in the morning with healthy fats, olive oil, eggs, or avocado, to maximize absorption. And don't forget to pair it with vitamin K2, which we'll cover in the next section. K2 helps ensure calcium mobilized by D3 ends up in your bones, not in your arteries. What about sunlight? While sunlight is a natural source of D3, aging skin produces far less vitamin D, and many seniors spend less time outdoors or live in low-light climates. That's why supplementation becomes essential after 60. It's no longer optional if you want to move well. So vitamin D3 is not just about preventing osteoporosis. It's about preserving the very systems that keep you independent, mobile, and mentally sharp. If you want to stay strong, avoid falls, and walk with confidence, start with D3. It's the molecular switch that tells your muscles and nerves, you've got this. If you are over 60 years old and feel like you are walking slower, less balanced, more prone to tripping, or your legs feel powerless, even though you still exercise, then the problem may not lie in your muscles, but rather in your nervous system sending weaker signals. And the common but often overlooked cause is a deficiency in vitamin B12. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an essential role in hematopoiesis, maintaining nerve health, energy metabolism, and reducing vascular inflammation. However, unlike many other vitamins, B12 is not produced naturally by the body. We can only intake B12 through food or supplements. After consuming B12-containing foods such as meat, fish, eggs, or dairy, the body must undergo a complex absorption process. First, stomach acid separates B12 from the protein in food. Then, a substance called intrinsic factor secreted by the stomach will bind with B12 and help it be absorbed in the final part of the small intestine, ileum. The problem is that after the age of 60, the concentration of stomach acid and the ability to produce intrinsic factor significantly decline, making the absorption of B12 through diet very difficult. Therefore, even if you still consume enough B12-rich foods, you may still suffer from severe deficiency, and the first symptoms often appear in the legs. One of the vital roles of vitamin B12 is to maintain the myelin sheath, the insulating layer that covers the nerves in the body, similar to the insulation on electrical wires. This myelin layer helps transmit signals quickly, accurately, and safely from the brain to the limbs, especially the legs. When lacking B12, the myelin sheath is damaged. The signals are disrupted or transmitted slowly, causing the legs to no longer respond in time, even though the muscles are still strong. As a result, elderly people will experience slight trembling when standing up, lose confidence when walking on uneven surfaces, or be more prone to tripping even though they still have muscle strength. This is not simply due to aging, but rather a disruption in the connection between the brain and muscles. According to a study published in the New England Journal of Medicine and EJM, the condition of B12 deficiency in the elderly is clearly linked to the phenomenon of peripheral neuropathy, a disorder of the peripheral nerves causing numbness, muscle weakness, and reduced motor control. In particular, this study shows that even mild B12 deficiency can affect gait and increase the risk of falls. In addition to its neuromuscular effects, vitamin B12 plays an extremely important role in the methylation process, a series of biological reactions that help regenerate cells, repair DNA, and reduce homocysteine levels, a mediator that causes vascular inflammation and damage to blood vessel walls. When homocysteine levels are high, due to B12 deficiency, the risk of stroke, heart attack, and cognitive decline also increases. An analysis from the American Journal of Clinical Nutrition shows that older adults with low B12 levels often experience faster memory decline and have nearly 3 times the risk of developing Alzheimer's compared to those with sufficient B12 levels. Mark Hyman, a leading functional medicine doctor in the United States, once said, "Vitamin B12 is one of the nutrients I always check first in elderly patients. Not just for strength, but for alertness, cognitive ability, and the ability to live independently." Unlike other nutrients, a deficiency in vitamin B12 may not show clear symptoms until the damage has become severe. However, here are some common warning signs in people over 60. Numbness or tingling sensation in the hands/feet. Walking unsteadily, trembling or stumbling even though the muscles are not weak. Mild confusion, difficulty concentrating or brain fog. Feeling weak legs despite eating enough. Depression or mild emotional disorder. Vitamin B12 is mainly found in animal-derived foods such as beef liver, red meat, salmon, tuna, sardines, eggs, milk, cheese, and seafood, scallops, oysters. However, as mentioned above, the absorption capacity decreases significantly after the age of 60. Therefore, most nutrition experts recommend that elderly people use B12 supplements, especially methylcobalamin, the biologically active form. For people over 60 years old, the usual recommended dose is 500 to 1,000 micrograms per day in the form of methylcobalamin. Prefer the sublingual form to absorb directly through the oral capillaries. No need to worry about overdosing because B12 is a water-soluble vitamin. The excess will be excreted. Vitamin B12 is not just a nerve vitamin, but also a switch that activates the ability to move, perceive, and live independently in the elderly. If you or your loved ones are on a journey to regain strength and independence after 60, don't just focus on exercise or calcium, start with a B12 check. Because strong legs not only help you walk, but also help you live fully, freely, and firmly as you desire. If you understand the vital role of vitamin D3 and B12 in protecting nerves and muscles and strengthening the legs, then the final piece in the trio of essential vitamins after age 60 is vitamin K2. This is a nutrient that is rarely mentioned in common recommendations, but it is a silent coordinator that helps strengthen bones, keep joints flexible, and ensure smooth blood vessels, especially when combined with vitamin D3. First of all, to understand why K2 is important for the legs, let's start with the distribution of calcium. Calcium is the main mineral in bones and teeth. But what few people know is, if calcium goes to the wrong place, such as accumulating in blood vessels or joints instead of in bones, it can cause arteriosclerosis, joint calcification, limited mobility, and persistent pain. This is why many elderly people take calcium supplements daily, yet still suffer from joint pain, arteriosclerosis, and osteoporosis. And right here, vitamin K2 plays the role of a traffic controller for calcium. K2 activates two types of proteins, osteocalcin and matrix GLA protein MGP. Osteocalcin helps bind calcium to the bone matrix. MGP prevents calcium deposition in blood vessels. In other words, K2 ensures that calcium goes to the right place, into the bones, and does not get stuck in the wrong places, such as joints or arteries. Lacking K2, calcium goes astray and causes a series of problems. Joint pain, calcification deposits, reduced flexibility in the legs, and worse, the risk of stroke due to hardened blood vessels. A prominent study published in the Journal of Thrombosis and Hemostasis, 2004, indicated that individuals with adequate K2 supplementation have a 50% lower risk of arterial calcification compared to the K2 deficient group. Additionally, the famous 10-year Rotterdam study also showed that older adults with high dietary K2 intake had a 57% lower risk of cardiovascular disease and a 26% lower mortality rate. For bones and joints, vitamin K2 works synergistically with vitamin D3. D3 helps the body absorb calcium from the intestines, while K2 directs that calcium to the bones. If you only use D3 without supplementing K2, you risk increasing the accumulation of calcium in the wrong places, especially in the blood vessels and joints. That's why experts, including Dr. Mark Hyman, always emphasize that D3 and K2 should go hand in hand. In a personal podcast episode, he once said, "Calcium is like soldiers, necessary, but without a commander, K2, they can cause chaos. In addition to its role in calcium coordination, K2 also has a lesser-known benefit: reducing chronic inflammation, a root cause of many age-related diseases. Chronic inflammation in the soft tissues around the joints is the cause of joint pain, swelling, and restricted movement, especially in the knees and hips. K2 helps reduce pro-inflammatory cytokines while improving blood circulation to muscle tissues, making the legs stronger and recovering faster after exercise. A study published in the Journal of Nutrition and Metabolism, 2013, shows that individuals who supplement with K2 exhibit signs of improved joint flexibility, reduced knee pain, and increased blood flow to muscle tissues. This is particularly important for the elderly, who often have impaired circulation and are prone to cramps, cold feet, or reduced mobility. Natural sources of vitamin K2 are not abundant, and this is why many people do not get enough from their diet. Foods rich in K2 include natto, fermented soybeans from Japan, containing -7 Malawian kwachas; hard cheeses like Gouda or Brie, -4 Malawian kwachas; egg yolks, chicken liver, butter, and meat from grass-fed animals. Among them, -7 Malawian kwachas, the longer form, has a longer circulation time in the blood, higher biological efficacy, and is widely recommended for use in dietary supplements. For people over 60 years old, a safe and effective dose of K2 usually ranges from 100 to 200 micrograms per day, especially in the -7 Malawian kwachas form. If you are taking vitamin D3 at a dose of 2000 to 5000 IU/day, then supplementing with K2 is mandatory to avoid calcium accumulation in the wrong places. It is best to take D3 and K2 together, after a meal containing fat to enhance absorption. Mark Hyman also frequently recommends K2 supplementation in health recovery programs for the elderly. He believes, if you are taking calcium and D3 without K2, you are missing the most important piece for bones and joints. He said, if you are taking calcium and D3 without K2, you are missing the most important piece for your bones and joints. So, in summary, what makes vitamin K2 an indispensable component if you want to restore the strength of your legs after the age of 60? Because K2 not only helps bones become strong and joints flexible, but also keeps blood vessels clean, fights inflammation, increases circulation, and works harmoniously with D3. This is not a random piece of advice, but the result of dozens of in-depth studies on thousands of elderly individuals. If you feel your knees are stiff in the morning, you walk heavily, or you have a dull pain in your hips after exercising, don't be quick to think it's old age. That could be a warning that you are lacking an essential-oriented nutrient, and it's time to incorporate vitamin K2 into your journey of bone and joint recovery. Because ultimately, the strength of the legs is not just for walking, but for living steadily, freely, and without being limited by age. One of the most overlooked drivers of physical vitality after age 60 lies within your cells, the mitochondria, often called the powerhouses of the cell. These microscopic structures are responsible for producing energy in the form of ATP, and they play a central role in how quickly your muscles can recover, how long they can sustain activity, and how resilient they are against age-related decline. All three vitamins we've discussed, D3, B12, and K2, work in synergy to support mitochondrial health. Vitamin B12, for example, is vital for methylation, a cellular process that regulates mitochondrial DNA expression and energy production. Without adequate B12, mitochondria become sluggish, and muscle cells can't repair or generate energy efficiently. This means more fatigue, longer recovery times, and a reduced ability to engage in physical activity, even simple walking or standing for extended periods. Vitamin D3 also influences mitochondrial efficiency by modulating calcium signaling and reducing oxidative stress within the mitochondria. Balanced calcium levels allow for proper muscle contraction and relaxation, while reduced inflammation ensures the mitochondrial environment is stable and productive. Vitamin K2 complements these effects by promoting blood vessel flexibility and reducing vascular calcification, improving circulation, especially to the lower extremities. When your leg muscles receive more oxygen and nutrients, they operate more efficiently and fatigue less quickly. Together, these three vitamins form a trio that supports not only the physical structure of muscle but also the internal cellular energy systems that power movement, balance, and endurance. Just as important is their collective role in reducing chronic inflammation, the hidden low-grade smoldering fire that worsens joint stiffness, weakens muscles, and ages tissues prematurely. Inflammation is one of the most insidious enemies of healthy aging. It may not cause immediate symptoms, but over time, it erodes the body's ability to regenerate, repair, and function optimally. Vitamin D3 has strong anti-inflammatory effects through the modulation of immune cells and suppression of inflammatory cytokines. B12 lowers homocysteine levels, a biomarker linked to inflammation and cardiovascular risk. And K2 indirectly reduces inflammatory load by supporting arterial and bone health. So, how can seniors apply this science practically? A simple daily protocol could look like this. Morning. Take 2,000 to 4,000 IU of vitamin D3 paired with 100 to 200 micrograms of vitamin K2, preferably -7 Malawian kwachas. Both are fat-soluble, so combine with healthy fats like olive oil, avocado, or eggs. Midday or afternoon, take 500 to 1,000 micrograms of vitamin B12 in the form of methylcobalamin, ideally sublingually under the tongue, for optimal absorption. Lifestyle pairing. Engage in 20 to 30 minutes of light physical activity such as walking, stretching, or gentle resistance exercise. Physical movement stimulates mitochondrial activity and blood flow, complementing the effects of these nutrients. To enhance results further, seniors can add anti-inflammatory whole foods like leafy greens, fatty fish, rich in omega-3s, turmeric, and extra virgin olive oil. Supplementing magnesium, a key mineral in muscle and nerve function, can also increase the effectiveness of this trio. Ultimately, restoring leg strength, balance, and confidence after 60 is not just about exercise. It's about addressing the cellular and biochemical factors that control your body's ability to respond, adapt, and thrive. When you nourish your mitochondria, reduce chronic inflammation, and create a daily rhythm that supports your body's inner systems, you don't just walk better, you live better. You are not powerless in the face of aging. In fact, with the right knowledge and consistent action, you have more control over your health than you may realize. As we've explored, Three vitamins, D3, B12, and K2, form a powerful trio that supports leg strength, balance, and overall vitality after 60. But it's essential to remember this. Vitamins are not magic pills. They are powerful tools, but tools only work when used as part of a well-rounded lifestyle. Your muscles, joints, and nerves don't just need nutrients in capsule form, they also need high-quality fuel from real food. Leafy greens, colorful vegetables, omega-3 rich fish, nuts, seeds, legumes, and healthy fats should be part of your daily table. These foods provide the raw materials your body uses to build and repair tissue, combat inflammation, support mitochondria, and keep your systems running like clockwork. Movement is also non-negotiable. Walking, light strength training, stretching, and mobility exercises activate the very muscle fibers that vitamins support. Physical activity doesn't have to be intense, just consistent. It's this daily movement that turns on your mitochondria, promotes circulation, and sends the message to your brain and body. I am alive, active, and ready. Mark Hyman reminds us, health is not just the absence of disease. It's the presence of vitality. And vitality comes not from shortcuts, but from everyday choices repeated with intention. So yes, supplement wisely. Track your levels. Choose high-quality forms of D3, B12, and K2. But also choose connection. Eat dinner with loved ones, laugh often, spend time outdoors. Choose movement, a morning walk, light gardening, a few minutes of stretching. Choose nourishment, not just from pills, but from your plate. Because stronger legs aren't just about walking easier. They're about standing tall, in every sense. Standing up to aging. Standing up for your independence. Standing beside your grandkids. Standing strong in the life you still get to live fully, one confident step at a time. If you found this video helpful, please subscribe, share it with someone you love, and let us know in the comments.